Hi, I'm Dr. Yatish. I'm a senior surgical oncologist, a minimal access surgeon and a robotic surgeon. I'm practicing for the past 20 years in Bangalore. And today I'm just take you through the few steps of what is the present fad in surgical oncology, that is robotic assisted surgeries or robotic surgeries. Robotic surgeries are those where the surgeon assists the robot or the robot assists the surgeons to perform complex surgeries in a more meticulous manner, in a more precise manner, with less blood loss, less cuts on the body, as well as less pain to the patients. So giving better outcomes when compared to open surgeries. Any robot in the market will have these three components. One component is the surgeon consoles where I am sitting it. This is called the surgeon console or the surgeon control console. Surgeons pretty much sit on a chair very comfortably, have a vision of what is going on to the patient's abdomen or in the thorax or in the patient's cavities, and then he will manipulate these simple things in my arms in a manner which is very precise and smooth, so that the surgeries or the movements of the surgeons on the console are mimicked by those on the patient's operating table. The second component of the robotics surgical things is a vision card. This pretty much has a bigger monitor on which your assistants or your support staff or your OT staffs will be able to visualize the surgery on the big monitor and then assist the surgeon in retraction or in passing over the instruments or your sutures or needles. This is the vision card. And the most important, the most exciting part of robotic surgeries are these surgical arm cards. These are individual cards. Sometimes there are 3 in number. Some of the companies they provide 5 numbered the surgical arm cards, and few of the manufacturers will have a single boom-like structure on which 4 to 5 arms are mounted, and these 4 to 5 arms are mounted on a single boom. These arms will go directly into the patient's cavity. The patients pretty much on this type of a cot. These surgical arm cards are placed on the side of these patients, and through these arms, the instruments called the robotic instruments, the cameras, the scissors, the bipolar cartridges or any energy devices are fixed onto these arms, and these arms, when they are brought to the side of the patients, are introduced into the patient's cavity via guidance through small incisions, or popularly called as keyhole incisions, hence the name called keyhole surgeries, or in technical parlance it is called as minimal access surgeries. And these arms, when they are focused on to your targets, the surgeon from the console will control these arms with very meticulous and very planned subtle movements, so that these instruments will actually perform the surgery on the patient's body. This is pretty much about the robotic surgical concepts. The advantages of having a robotic surgeries is that the first one is patients will not have large wounds to make. That is, when you want to cut open your abdomen, we have to make at least 6-7 inches of wound so that you gain access into the abdomen of the patient. Do what is necessary with your hands and with your instruments. The abdomen walls are retracted, and these retractions in the post-operative period are very painful. When compare these incision to small 1 inch or half an inch incision on the patient's abdomen, through which these instruments are inserted, and these instruments are controlled very precisely in a manner which is very subtle, very precise, very composed manner. You have surgical outcomes which are better and painless when compared to open surgeries. That is one critical aspect of any minimal access surgeries. The second one is the post-operative outcome is very good. It is sometimes better or comparable to open surgeries in terms of results. and the patient's recovery is very fast. Patients require less amount of analgesia, less amount of painkillers in the post-operative period, and that makes a huge difference in patients' recovery.